So talking about, the Dutch test and why I think it's so important is because it really does allow us to get your own personal picture. And there's so many things that can happen with hormones, as we'll sort of discuss as we go over your results, Kim. But there's so many times that we can talk about low progesterone or low estrogen or high estrogen, or that the pathways are just very stressed, either because of trauma, stress, imbalances, or even genetics. So you'll see how we can really get an individualized approach by looking at the Dutch. So what I want to do you have any questions or anything before we start to go through yours?
No, I just am curious to see what my test, because
Okay. So if I do this, you can see this now, right?
yeah, okay, cool.
Okay. Yep. So that's what I was trying to do. And what I think is really important is that people can actually see this. So this is coming through pretty clear on your end.
Okay, yes.
Okay. So Dutch test, what it is it's a dried urine comprehensive test, but by looking at the urine and those metabolites, we can get a lot of information. There is 4 major pages, so I'm going to share those 4 pages and go through those with you on what your test results
So,
show.
so these numbers on here are not like where it says point two. Is that my number?
Yep. Exactly.
Oh, okay. See, I didn't know even how to read that. Okay.
Yeah.
Okay. Oh
So
shit. That's okay.
really low. Exactly.
Well, no, I mean, see that when I look at it, if you don't have someone point it out, I didn't know what to do. Oh
Yeah.
God.
Yeah.
So I have no, what is that? The first,
Estradiol, which is the major estrogen. So
okay.
you're
So,
really low on estradiol, estrogen, and progesterone.
and I'm high testosterone. Does that mean I'm getting a stash?
Well, no. So here's the interesting part is that the balance part of it, you're actually not high testosterone. You're not out of normal range. You'd have to be above 14 for us to consider you high testosterone, but you're high testosterone compared to estrogen and progesterone. And so you can then have, all the side effects of feeling like it's higher testosterone while you're also having all the side
Mustache?
effects.
Like what else? Anger?
A little bit of rage, yeah, a little bit of rage, irritability, definitely the hair and hair growth can be that too. Now you don't usually see that as much because you don't have like an extremely high testosterone. It's just much higher in ratio than your estrogen and your progesterone. Now, mind you, as we get into perimenopause and menopause, our numbers are going to go down. But what we're seeing a lot of times is someone who's been exposed to a lot of mold, trauma, stress, Lyme. Theirs are a much lower because they've sort of burned through it, and that those levels then will be a lot lower, and then it's harder to get better and to push past anything that is a stressor in your body when you do have the lower levels. And that's why we really want to take a look at these and do everything we can to help balance it out. And this first page is your cheat sheet. Like this is just sort of everything, in review pretty quickly, but there's going to be a lot more details as we get to the other pictures. So,
So the
oh, go ahead.
cortisol is super high,
Yes.
right?
No, your cortisol super low. Like your curve is a little bit less than optimal. So if you go into the picture on your bottom left and see that daily free cortisol pattern,
Uh-huh.
do you see what's happening is you're not getting as much of an increase in the morning. Like we should spike our protein about our cortisol about 5 or 6 a.m. And that gets us to lower our blood sugar. So we should get out of bed, want to eat, and get the day going. You're starting on the low end and then you're trying to fake it till you make it and you're staying elevated, but your body will really feel it when it doesn't have that curve because it doesn't have the oomph. Mornings are really hard and you'll feel like you're dragging yourself out of bed, but it's because what we'd have to do with you is to discuss how to get those cortisol levels up through supplementation and lifestyle. There are things that we can do that way.
So without like knowing that I told you my symptoms, would you be able to look at something like this and tell that I can't sleep?
Yes, progesterone would really start sort of by zoning into progesterone. Progesterone and estrogen, a lot of times we will talk about progesterone being the good hormone and estrogen being the bad one, like just because of the fact that estrogen is sort of I am woman, hear me roar. Progesterone is
Mhm.
I'm calm, cool, and collected. And we need both of them as a female. We need that I am woman, hear me roar, but we also need to be calm, cool, collected, and nurturing. Progesterone works with GABA, which is a calming neurotransmitter to us. So people who are low on progesterone have a really hard time sleeping. One of the first things we'll see if someone chooses to do bioidentical hormones and goes on progesterone, it'll be an instant best friend because they're all of a sudden sleeping through the night, not waking up, and getting restorative sleep again. But
Which was interesting because they had me on the progesterone, the 100, and then I had the estradiol, but I don't know if it mattered for me sleeping. I
well,
don't know.
and maybe too, the thing is too, is I mean, that was, I know, a long time ago and a lot of things have changed.
Mhm.
Yeah, no, in like really when you look at symptoms, the low progesterone is going to be where you have trouble sleeping and insomnia for the most part. And then that cortisol curve is going to be that you're going to feel fatigued throughout the day, especially in the morning, and not be able to really get yourself up and
Oh,
going.
100%. That I could, if I could wake up at noon every day, which sometimes I do, because I don't even sleep till like 4 or 5 in the morning because I'm like wired.
Mhm.
That's exactly
And that's what
what.
your cortisol curve is exactly showing, is you're probably doing some stuff to help stimulate your cortisol, like even if it's just natural stuff, but your cortisol curve is now much more like in the afternoon, we're on that high end and high range, and then you're really low in the morning instead of getting this steep curve in the morning. And so those are people that really do have to sort of pull themselves up by the bootstraps to get going in the morning. Um, the other thing with it too is estrogen is that I am woman, hear me roar. So this really just shows somebody that's depleted and needs support to get everything balanced and sort of get into a state of better vitality.
Okay.
So so this is the beginning, and this is the first, sort of reading that we get with the Dutch test. And so it really then lets us be able to just say, okay, here's the overview of everything. Now I'm going to show you the pathways. So let me stop screening that one and say hello. And then let me
Now,
show
is
you.
mine like a typical like thing that you see for someone like my age with my symptoms? Or is it like
Yes and no. So somebody actually, this is a great question. Someone could come in like you with almost the exact same symptoms and be a completely different Dutch profile, because
okay,
maybe you have normal progesterone, but you have really low estrogen, and maybe your cortisol curve is below that curve, or sometimes the cholesterol curve, you're just pumping out cortisol. And
mhm.
you'll sort of feel very similar to some of the things that you're feeling. And that's why I really highly recommend women do the Dutch test and get an assessment of their hormones and take back the knowledge of what their pathways are. And we'll talk about this more in the next screenshot because
Everything I was trying to do on my own didn't work. I mean, I was taking all the wild yam, like all the supplements that people would tell you online, and that's why it's like I can't. Thank you, thank you. It's
yeah,
like when you're not getting better, it's like you can't have this generic. Like every single thing I did, or
yeah.
every supplement I was buying, I thought I was doing the right thing, but nothing was really helping me.
Well, that's why I absolutely love the Dutch test for women, is because this will let you be able to start to really look at you. Because I know you can do blog treatments where you go and you read one blog after another and end up with a
Love
lot
it
of
all.
great things, and end up, maybe on maca and calcium D-glucarate and DIM and all of those
I
things.
just packed like probably 30 supplements I spent a
Yep.
shit ton of money on,
Yep.
of the GABA, of the yam, of the
Yep.
black, and yeah,
Well, and all you have to do to really know that too is go and read what estrogen dominance is and high estrogen levels. Then go read what it's like to have low estrogen. And they're very similar. Like a lot of them repeat the symptoms. So that's why, you really do, I think, have to do a Dutch test. And I highly recommend it. I highly recommend it for young women too. Like if you're 14, 15, 16, 17, and you're having periods and they don't seem right, the only option you're given in traditional medicine is go on birth control. Do a Dutch test and see what your pathway shows, see where there's interference, see, and a lot of these things that we'll talk about with this next screenshot are genetic. So the Dutch test is just so empowering. I can't say enough great
that
things
that
about
I'm
it.
curious to see. Okay.
Yeah. So
So
now
okay.
you're seeing this one, right?
Okay. So okay. I just don't know what
Is
one
this the
even.
same one? I think this is,
No, it's the androgen, the DH, the
okay.
yeah.
Let me, I clicked. Okay, well, okay, so you are seeing the one that says like androgens, progesterone, that.
Yes.
Okay,
Hmm.
perfect. So what we're looking at here then is we're actually looking at how everything is breaking down, which is awesome. So this is really, I think, the page that gives people the most individualized answers. Because what we're looking at is the way that the hormones work is there's sort of always say three columns and they all have to talk to each other. There's the progesterone column, which is that first column of how all of our hormones come in. There's
Mhm.
the cortisol, which is the stress response. That's the middle part of our hormones. And then
Okay.
there's estrogen and testosterone, the precursor of DHEA. The reason it's so important is because they all talk to each other. And like, for instance, if your adrenals and your cortisol levels are off, your progesterone and estrogen aren't going to really be able to talk to each other because there's so much interference. Then this is where we can look though and see, are there genetic components or that your pathways are just not working the way they should. When we talk about something called MTHFR, which a lot of people have heard of now, which
I think I have that. I think I got a myriad genetic test.
so whether or not you have it right now, you're doing a really good job of supporting it. And that's why this one's going to tell us that. So if you look at this first category, which says DHEA and testosterone,
Mhm. Mhm.
so what is happening here is that you have a normal, but a lower, like a slightly lower level of DHEA. It's on the lower end of normal.
Mhm.
DHEA is the precursor to testosterone and estrogen.
Okay.
And so what happens then is that we want that DHEA to be high. And that's why some women like postmenopausal will just take DHEA to help keep their estrogen and testosterone levels high without taking like a foreign, hormone.
Interesting. Okay.
And that's because it goes into and it helps to convert to testosterone. And then as women after testosterone, we'll convert it into and aromatize it into estrogen. And what we want to make sure is we're not producing too much DHEA and testosterone. That'd be like a PCOS situation, polycystic ovary syndrome.
Oh, okay.
But then if you go to the end part, you'll see on that category that if you look at your testosterone levels as you break them down, they get a little bit higher. That means you have a little bit of a problem breaking it down, which is called 5-alpha reductase activity. But here's what that means for a layperson. Those are people that if they get too much testosterone, they'll get more acne, they'll get more facial hair, like they'll push that testosterone pathway. So I know you brought up facial hair. Like, do you get any facial hair acne?
No, I was just kind of kidding. No,
Okay,
and I do not have, like I have one little blemish, but I've never
that's a
had like
cystic.
acne.
And that doesn't shock me because your levels aren't that crazy high. They're just higher compared to estrogen and progesterone. But what we would want to focus on with you is really leaving this pathway alone. Now, if you came in and that's where too, you want to always put this with symptoms and said, I have very cystic acne that breaks out, then I would think about putting you on something natural to help break down and support that 5-alpha reductase activity.
So this would be like a great place to start if you had cystic acne.
If you had cystic acne, all people with PCOS, polycystic ovary syndrome, this test will change your life because you can really figure out where those problems are in your hormones and actually
Mhm.
then
Mhm.
individualize it. And I see so many different patterns and different kinds of PCOS. Some people will just have the higher DHEA and the higher testosterone. Some will have methylation problems, which we'll talk about. Some people just have really high cortisol. So we know then how to help balance it the way that you should. And what I do when I go over this with somebody, and I know we talked about this, is I give them specific recommendations, but just, so that people don't hear this and say, oh, I should do what Kim's doing.
Right,
I'm
because
telling you like what I would
Mhm.
supplement, but I'll send you all my recommendations for you. But I just don't want somebody to watch this, take your results and be like, okay, I'm going to go on the same supplements as Kim because they probably aren't going to be the right thing. And I just don't want
That's why we had to go back and do this because I did that. Watch so many, TikToks, YouTubes, research my own information for insomnia, for this, for that, and I've taken all of them, but when I don't have the right cocktail, it didn't work for my body. None of it worked, or we
yeah.
wouldn't be sitting here, right?
Yeah.
I
And I
mean,
just don't want, I just don't think I
right,
just don't want anyone to take your information and then say, I'm just going to take those same supplements because we don't know if that's what they need.
right.
So, that's why, with these pathways, then I can say, okay, this is what we would do to support. And like I do with anybody that I go over this with, I will send you a list of the recommendations.
Mhm.
But I just don't want to get anybody like more confused because this isn't their results, it's yours. And then the next part, then if you look, they're going to show you your progesterone. So you can see up there
Mhm.
progesterone and how you break down progesterone. You actually have good pathways. What you don't want to see is somebody that has like a fluctuation of like the low progesterone and then the high byproducts of the pregnadol versions and components, because that means they're not breaking down progesterone. You're depleted. So you're depleted in progesterone and estrogen. That's the takeaway, which is very common after mold. It's very common after Lyme. It's very common after stress, because with what the body has been demanded to do during those times of stress and trauma, the hormones then a lot of times then become very depleted. And that's why we then want to do also support while we're going after the mold, to support the hormones, that you also have that in the tank so you can get better.
Now, do these levels, can you tell, and I don't know why this is in my head, can you tell like for a weight gain or like metabolism type thing? You know, they say like during menopause, you put on weight, things like that. Would these supplements or getting the hormones right make my metabolism better?
Yes, very much so. So we do see, I mean, a lot of women, especially estrogen, when the estrogen's really low and we get that right, one of the first things that women will say is, oh my gosh, like I'm able to lose weight again.
Interesting. So that would make sense why I feel like I'm stuck with my weight too, right?
Yep. No, but you're just going to feel like in a lot of ways, energy wise, metabolic
More
wise,
energy.
that you're just stuck. Like, and hormones will make you stuck because they are a way of like vitality and support and things like that. Now, if you look though at then your estrogens, there's three major types of estrogen: estrone, estradiol, and estriol. Estrone is the one that we tend to start making more towards menopause. Estradiol is our main estrogen, and estriol is a weak estrogen, similar to estradiol, that we make throughout our lives. You'll see across the board you're just depleted, which is then somebody that's depleted. And that your body just isn't going all through that pathway to make estrogen. So that's where we'd want to do things to help support the estrogen pathways. When we look at though how you break it down, that's where we're going to see those, the blue, red, and green arrow, which are going to three different breakdowns. Now, this is very complicated. So there are doctors who do not understand this. So don't feel like you need to, and I always say this to patients, don't feel like you need to look at this and understand it fully. But I do think it's important, and that's why I go through it with each person to understand what it's showing. Your pathways actually look really good, because what it's showing is, if you look at it, it says 16OH E1 and then 4OH E1. Is that what it's showing? Is it's showing the breakdown of something called 16-hydroxy to 4-hydroxy to 2-hydroxy estrogens. All that means is that if the top one, if 16 is way high and the other ones are way low, that you're actually holding on to toxic estrogen. You're not going through the detox pathways. We have to open up your detox pathways. You actually, and this is probably honestly because you took this when you started doing all those detox support.
That's what I was just going to ask you,
Yeah.
like the detox. So you can see the detox baths and the castor oil and all that stuff and the supplements I've been taking, right? Like
So
this.
your
Yeah.
detox pathways are working for you now, whether that be genetically you're a strong detoxer. But in this case, especially because we know your history, you're not, even if you were the best detoxer in the whole wide world, your detox pathways have taken a huge hit from, your recent
Right.
history, that then the detox pathways would be completely backed up. And then that's where too, there'd be a concern of, okay, until we open up your detox pathway so you can manage all of this, we're not even going to touch anything with hormone support, because we don't want to add more into a clogged sink.
Right. Right.
So it's really good. And that this is always, when I'm looking it over for the first time before I talk to a patient, this is always the first place I look, because you're going to see how well is someone detoxing, what do their detox pathways look like. And then also, if you follow it down, you'll see that it takes that last one, the 2OH, which is 2-hydroxyestrogen, into something called 2-methoxyestrogen, which is how are you methylating. So that MTHFR, the B vitamin usage, and methylation, that all goes into this. So you're methylating right now and you're detoxing like a superstar. So we're going to,
that's good. Okay.
yep, and we're going to use that to our advantage. And and it's also great because it shows you that what you have been doing has been helpful.
Which is, I'm telling you, the magnesium was huge.
Right. Yeah.
I still feel like I'm clogged up, which is another part of this, but
well, and the good news is too, is this is at a very cellular level too, because of the way that we're looking at these byproducts to see in the urine if those byproducts are there, and if they're high, it means at the cellular level it's getting dumped because it's not actually going through the right process. So, but you can't detox at the cellular level if you're not pooping right. Like there's just no way around it. So any other questions on this one?
Mm-mm.
Okay. So yeah, so that one is like my favorite page because it really does let us see, you know, what exactly is going on and be able to then say to somebody, hey, like I said, not only, you know, do we have to do like this pathway, but it also gives us a little bit of insight in what's going on through detoxification and where the estrogen levels are. You can see this one right now with a guy with a brain that says hypothalamus.
Mhm.
Okay. Do you take melatonin at all?
I have it, yeah. I mean, I do. I don't think it helps me.
Were you possibly like, had you taken it around the time you took this test though? Possibly?
No,
Okay.
I almost never. Why? Does it? It's high
It's really high. So that first number, the 3,698 is your melatonin level
in the morning.
in like, yeah, right when you wake up.
So that's why I'm
Yep.
completely
That's exactly, yeah. So
messed up.
your circadian rhythm,
No,
your circadian rhythm is completely off. That's a major
I,
part.
I, 100%.
Yep.
I am
And
wide awake at night and I'm exhausted in the morning.
yep. So when I send you information, I'm going to send you, there's a lot of lifestyle things that I do then to get people's cortisol and melatonin with a little bit of supplementation. Right. But it's going to take like, it's going to be about a 2 to 3 month process just because, you know, you've got to slowly get those circadian rhythms, but you're all kinds of mixed up
I know
right
this.
now.
I'm wired and I don't even do like caffeine.
No, right now, like if you did caffeine, especially because you'd probably get caffeine right when you wake up, you'd be driving your adrenals and your foot would be on the gas and the brake at the same time. And you would probably just get incredibly like revved and jittery with caffeine right now. If you did it, especially like in the morning, like if you tried to do caffeine right when you wake up with your melatonin levels and your cortisol levels and all of that,
And
you probably feel wired, tired, and totally jittery.
besides the supplements, I have been off my ADHD meds too. So this is
Mhm.
because I was like, is that part of it? And now here's proving it isn't part of it. That was what I was my big issue with that stupid doctor was. I'm like, I'm not
Yeah.
even taking that. I'm not, because it
Well, this is where it's so helpful because now that you have actual information and you have, you know, some understanding, don't you feel like more empowered, like, and that you're not crazy?
well, I know we know I'm not crazy. That I mean, the thing is that's so frustrating for me is like I know so much,
Mhm.
like for being around like that, like of what to do. But if you do not get your own results, it's like you're, throwing spaghetti at a wall.
Mhm. Yeah.
So this is just a part of it to say like, okay, I know my body, I know I'm doing everything that I know to do, having sleep hygiene,
Yeah.
not drinking caffeine, cool, like every single thing I was doing right, but I'm still not getting better. So
Yeah.
it is definitely makes a ton of sense.
And just need to fine tune it a little bit for you. The other thing too is that, you know, when you look at melatonin and those, well, first of all, like it's a very good sign you're overproducing melatonin in a way because melatonin is very protective. It has a lot of neuroprotection for our brain and it has a lot of protection actually too for the just overall, like it's an anti-inflammatory and that's why we produce it at night to rejuvenate and replenish. And so I do like to see somebody with higher melatonin way before I'd like to see somebody with lower melatonin. But the thing too, because as you said, this is a waking one, this tells me right there and then that you just have the circadian rhythm that's completely off,
It's completely off.
which goes along with what we're seeing with your cortisol because your level is lower than it should be in the morning and then you go into the higher end of the range in the afternoon and evening. And so you just start to get going. And so the reason this is probably so high is because you're starting to really, we should release the majority of our melatonin really between 10 to 4 is really like if we were like things were perfect. You're probably much more like 3 4 hours, you know, off of that. So you're probably releasing the majority of it from like 1 to 8 or 1 to 7 or something like that.
Right. But now would you see like a mast cell from this? Like with this?
No, so I mean, mast cell and mast cell activation, is its own little spectrum and world. Now we can see when there are individuals that, like for instance, if your adrenals are off and you have this tendency towards histamine, which is the mast cell activation, then, that's like we can find driving forces of histamine and mast cell activation. But when we really look at like if we were going to diagnose somebody, we can't diagnose them off this test. Really, this test isn't meant to diagnose anything, or any disease. What it's meant to do is give you that information so you can balance out and get out of like dysfunction.
Yeah, taking all these random supplements, it has
Mhm.
done, I mean, maybe it's done something for the pathways opening, but for any of this, it's still here. The
Yeah.
issue's still here, right?
Right. And that's why too, I mean, now, looking at this, the other thing too is there is not technically like a great supplement to decrease melatonin. What you have to do, and what we'll talk about with you, is we've got to get your cortisol levels and your circadian rhythm right. So we'd actually go towards the adrenals and do a lot of things, actually, truthfully, with diet, lifestyle, and some supplements to get the cortisol right. And then, get that melatonin. We're not wanting to shut down your melatonin production. We just want to get you to release the high levels while you're sleeping and during the time that you should be sleeping, not, right when you wake up, to be in the 3,000 range.
So just from looking at this, you could tell that I don't sleep because my
Yeah.
melatonin is so high. Okay.
But the cortisol too. It's really that whole curve.
Okay.
Yes. With It would shock me if you were a great sleeper with high melatonin, like when you wake up, because it means that you're producing the majority of it then, with the cortisol levels and with your progesterone level.
And
Those
see, this is such a huge tool for this freaking psych doctor who's like, I'm giving you everything, you can't sleep, da, da, da. And if you saw how much I was taking, it was awful. From the Advil PM to every single supplement, and then I was taking their hardcore things, and I was still wide the f awake. And here you go. This doesn't lie. I'm reading right.
Right. And the thing is, too, is a lot of those medications are all going after the neurotransmitters, and the neurotransmitters, hormones, they really, and even the immune system, I mean, and especially histamine. So you've got all of these that talk to each other. But like if you're going after neurotransmitters, but it's more histamine or hormones, then you're only maybe putting a small band-aid on it. But then the real problem is going to come up. And that's why you have to get to the root cause.
Right. Okay.
And then the last page that like we really look at, um, it's sort of a cool page. So these markers, you'll see a bunch of different markers.
Okay.
So these are when you get your Dutch test, which you'll get when if someone does it, is they'll get those charts that I just showed, and that's where you're going to get a ton of information. And they put it in, as you can see, these charts that just make it so interesting and help you to be able to decide what everything means. Then you get all the numbers. So there'll be like 4 pages of just something that looks like this that are
Right.
numbers. All those numbers are in the chart. So when you go back and look at yours, Kim, you're going to see pages that sort of look like this, but they're all the numbers that were charted out. So you don't have to go and like look at each one separately. You can see the big picture with the chart. What this page though is, it's called the organic acid test part of the Dutch test. And it comes each time with anyone who does the comprehensive Dutch test. These are a bunch of markers that aren't necessarily in the hormone pathway, like they're not the progesterone or estrogen or its byproducts, but they're things that all have an effect on the hormones. And so this is really interesting because, like, for instance, you'll see your B12 marker, which is methylmalonic acid, or your MMA, that's on the high end. So that means that you're deficient probably in some B12. So you need methylated B12 to help. And that makes sense because adrenals need the B12,
Right.
detoxification, and those kind of components to need methylated B12. So you just have a need for a little bit more of a methylated B12.
Okay. And that's different than a regular B12 of the,
Well, so there's really 4 major types of B12: cyanocobalamin, methylcobalamin, adenosylcobalamin, and hydroxycobalamin. The majority of supplements will use cyanocobalamin, which is a cheap one that our body doesn't use very well. They've gone away from it a lot because people who have MTHFR genes do terrible with cyanocobalamin.
Okay.
And so like the cheap supplements, if you look at the back of a supplement and it has B12 and then it says cyanocobalamin next to it, throw it out. It's a terrible supplement. They're using cheap versions of everything. And nobody really, I think, in the supplement world should be using cyanocobalamin anymore. It's also a B12 attached to a cyanide molecule. So we just don't need to use that one. Methylcobalamin or methyl B12 is in a lot of the higher end. Well, in
Right.
the
Well, that's what
molecules.
I went on to. That was like one of the first things I
Yep.
think I learned from working with all is the importance of like good medical.
Quality supplements.
Oh, medical. I won't even touch
Yep.
because you can see just taking them the difference. I mean, you're wasting your money, I think, taking the
Yep.
crap.
Yeah, no, definitely. That's why you want to make sure that you've got a good supplement and a good supplement company. Then if like, so for instance, if you had looked really bad on the methylation, which we talked about in that estrogen pathway, then I would maybe even talk about putting you on more of a hydroxy or adenosylcobalamin, which is one that like people who have really bad MTHFR problems with methylation might have to go to that version because of the fact that it works a little bit better in very sensitive people. So, but you would do, because of like what we saw with your methylation, you would do very, very well with just a methylated B12.
Okay.
B6 is also plays a huge role in hormones and methylation, detoxification, and all of those factors. But your levels here for B6 look good. Now,
Okay.
here's where you're gonna, what happens is we also check pyroglutamate, which is actually our marker for glutathione. And you're gonna see that you're above the range on pyroglutamate. Do you want to guess why?
On gluta. Okay. Because I'm taking a supplement. No,
No. Are you taking glutathione?
didn't. I don't know. I thought you gave me one of those. Did you
Yes.
not?
And why did I give you glutathione? Do you remember?
I don't. But I
From
just started taking it.
Yeah, okay. Well, that would make a lot of sense. But glutathione is a major antioxidant and detoxification factor for us. It gets depleted with mold. So because we use glutathione to help to detoxify, it needed to detoxify mold, yeast, candida, all of those things.
Mhm.
It's very common to see somebody who has mold exposure. It's not the only reason, but one of the reasons we will see a pyroglutamate off is because their glutathione levels are affected because of the fact that they've had mold, yeast, or candida.
Okay. I wonder if that's candida.
And it could
Probably.
also be your mold. So it can be either or.
Which I do have that white tongue. So I'm sure I have candida too.
But then what you would want to do is you would want to go through, you would want to take glutathione. And I always recommend when people take glutathione to also take NAC, which is the precursor.
Right. And I think you gave me that too. I think I
Yeah,
got that.
yeah.
Okay.
But then you're also going to want to go after and do some support to get rid of candida, yeast, and mold. And
Okay.
then you'll see your biotin levels look okay. And so biotin looks okay. There is a gut marker on here called indican, but I will tell you, there's a lot of people with gut issues. That indican is it's a test that we can do through the urine, and when it's high, we know that there is some gut issues. I know we know that there's some gut issues with you too, but indican will not always show up. So
Okay.
it's not like a perfect marker for the gut, but it's
Mhm.
nice sometimes because sometimes if somebody isn't focused on their gut and it's just horrible, then that gives us the if we do see it, we know for sure there's a gut issue, but there's a lot of people with gut issues that indican doesn't show up. So it's not a perfect test, but it is nice just to have that. And then you'll see it also looks at the neurotransmitters because they talk so much to the hormones. And so that's where we'll see homovenilate and the VMA and the quinolinate, which are all going to show us then different markers for like dopamine. So the homovenilate is a common one, that first one in dopamine. Now, I have seen I've done the Dutch test for years. I mean, I've done the Dutch test, gosh, with people for, gosh, I don't even know how long, but I've done thousands and thousands of Dutch tests with people. And almost everybody lately, I would say, when they have hormone issues, have lower dopamine. Now, I don't know if it's like we are all living in a little bit more world of stress. Dopamine is a neurotransmitter that's there for focus, attention, and motivation. Like it's the one that should like be high levels when our brain's just
Mhm.
in tune and focused. I don't know, I will say that it goes a lot with hormones too. And our methylation pathways go through the hormones, and then they also go through our serotonin and dopamine and even something called norepinephrine. So I don't know if it's just because when hormones are off that the dopamine will also go off. But I also think that honestly, a lot of us are burning through dopamine from our lifestyle because of the fact that, we're very like, even, staying connected to everything on our phone and whatnot. But I, in probably the last 2 years, have seen almost, gosh, I would even say 80% of all of the tests that I do have a low dopamine marker. So there's two things with that. I do see when we do retests after, we get people's hormones right, that the dopamine will come up. But I also will put people on some supplements to help with dopamine, because the other thing too is that I have found with people, when we can get their dopamine up, they have more attention, they have more motivation, and they just feel better. So there are products that I really like, that I will send you to help increase your dopamine.
No, that definitely is interesting to me. So, looking on something like this, when you do look at the dopamine, and I know there's, obviously the direct correlation between dopamine and depression, anxiety. Can you, like, without anybody telling you a symptom, would you like look at something like this and be like, okay, she has panic attack, or she has depression or anxiety from just this? Is this like a common?
No, I mean, not necessarily, because I think that so many things manifest differently in each of us. So some people, some people are just more prone to anxiety and panic attacks. Some people, because they've had them before and have a history of them, they'll have a panic attack or anxiety really quickly, where somebody who hasn't had them, then they can have all these same findings and not have um, that specific symptom. So what really does happen when we go through this individually with someone, we can start to tie what they're going through with why in this, but it's not necessarily like you can see this and then completely predict what somebody is going through. But definitely, you can sort of say to somebody, if you don't have a working relationship with them, and let's say they did this first, and then, I would get on the phone to talk to them, I could probably, give them sort of a picture of what I think a lot of their symptoms or how they feel, because, hormones really do drive a lot of that.
This would have been really interesting to have done right after I had a TBI, because I mean, I haven't even given you even half of it when he started throwing me all the Parkinson's and memory stuff. And I took it and I was like, you know what? I know better than this. I am not taking this shit.
Mhm.
And, like, didn't, but I would have loved to see how inflamed my brain was. Because I kept saying to him that was a big part. I'm like, I didn't hit my head. Like, it was the craziest thing. It's like, I don't remember hitting my head.
Yeah.
And that was like, I mean, he's like, did the MRIs and stuff, and was like, well, that's not what the MRI said.
So what's been happening a lot with concussions, and there's a lot of research on this too, is concussions really, a lot of research on concussions points to progesterone too. But for actually both men and females, they have done research about if you have a concussion and that neuroinflammation that happens, you will see on this page that neuroinflammation marker, which is the third from the bottom, the quinolinate. Those are probably that, like, almost always we're going to see that higher after a neuroinflammation process, but that can be stress or TBI. And then the last marker, oxidative stress, which is 8-hydroxy-DG, that's a marker.
3698, and it's supposed to be 10
No,
to
no, 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 no.
85.
That's your melatonin. That was the
Oh,
melatonin that we already talked about. But
waking. I'm gonna send this to that stupid girl. Sorry. This is crazy. 10
yeah,
to 85 is high. Mine is at 30. I mean, that's freaking insane.
yep. You're pumping out a ton of melatonin when you shouldn't be.
I
So,
want it at night.
yep. Like your like
I'm
midnight is probably 6 a.m.
100%.
But
And
that's
that's
what really throws it, because melatonin too is supposed to correlate with like the sun. And so that's also like somebody like this, it throws everything off, because like, so, when you get sun exposure, that's supposed to get the body into more of a cortisol, less melatonin and whatnot. So yeah, no, your complete rhythm is just,
that's crazy. And that's not usually, like, is that supposed to even be that high at night?
yeah, no, we
Okay.
really should like pump out a ton of melatonin at night. And then, a couple hours before we wake up, get down to almost zero. But no, you should pump out a ton of melatonin at night, and it's
And which
protective.
makes sense why I have chronic fatigue, because I
Yeah.
freaking melatonin pumping. This is like so good, I think, for mental health too, because
Yeah.
it's been so hard for me here of like not knowing anyone. It's like, just get out of the house. And I was like running marathon. I was like, I
Yeah.
try to do all these things, and I'm like, you don't understand. I cannot wake up. Like, I cannot get off the couch.
Yeah.
This is
No,
why,
it really,
because it's
yeah.
my hormones. It's not like in my mind. It's like, oh, you're depressed and this and that. And I was thinking to myself, I mean, I've been depressed and depressed like things before, but like this is like my body physically cannot wake up. And here we go.
Here's the reason too, is that, I mean, when you look at this, I mean, all of those things are the currency of vitality, is what I tell people. And you're working on minimum wage here, and so that's where too, what we have to do is get your vitality back, but get you back balanced. Because if not, I always tell people, to me, hormones are like an orchestra, that it's not like one is good or bad, but we want them all on the same sheet of music. And right now, your estrogen and progesterone are, that the flute section and the percussion section are like done. They're not doing anything. And then you've got, your melatonin and your cortisol just like completely going crazy. So we've got to get it all balanced out, and we can, and now we can, because we know what's going on with you. And specifically what we have to focus on.
And do you think part of it is like making myself get up earlier? Because
Yeah.
now that,
That's the other
oh,
But that's the other thing I love about a Duchess. So if I was to say to you, like, if I was just to say to you, hey, Kim, you've got to start getting up early and even doing some exercise, like even 5 minutes, like the Tabata, or just some kind of exercise to drive your cortisol, then you can do whatever you want. Like if I was to say to that, you'd be like, okay, maybe, but then like, you're not going to feel better in a day or two. It's like, you've got to commit to doing this for a month. When you see this, information about you, it's much easier to say, like, I know why I'm doing this, so I can do it, versus like, if not, if it's just like, oh, it seems like your circadian rhythm's off, why don't we try A, B, C, and D? You're going to give up before you keep going, because of the fact that you're not going to feel better. With these patterns have been here for so long, they're not going to
oh,
get changed in a day. And we sort
yeah,
of know that, but when we're throwing, spaghetti at the wall, if it doesn't stick right away, then we just figure it's not going to stick. When we know what the information is, and then we know that, okay, this will stick, it might just take some time, it's easier for you to implement the supplements and the lifestyle. And it's easier for me to know that we're doing the right thing, and I'm just not guessing off of symptoms and hoping it's all right.
and what's interesting, I'll never forget, I was in Texas, and it was her name's Dr. Claire, was doing this muscle testing and all different things on me, like testing me. And she told me, she's like, your whole circadian rhythm is completely switched. Your body is switched. And this was like 2 years ago.
Yeah.
No, maybe like 4 years ago. Shit.
Yeah, no, yeah, no, and I'm sure, like Kim, the other thing too is all of these patterns did not happen overnight. You
No,
know,
right.
that's the thing too, is like where your levels are, and those levels. Like, so for instance, if I burn the midnight oil a little bit this weekend and I take a test, my melatonin isn't going to be that crazy, because, maybe, it's off a little bit from my sleeping pattern being off. This is years of like reconditioning that's happened, and these patterns that have set in. So that's where it's like, yes, we can change those, but it's also a lot more helpful when this is what we have to focus on. Like, for instance, your detoxification, your methylation look great. So I wouldn't, I would keep you going on that path, but I'm not going to throw 40 new things into that realm. That's not going to make much difference, because that looks pretty good. We want to go to where there is these sort of breaks in the chain, because of the fact that they need a little bit more support.
It's like nothing short of a miracle that I'm like not taking Ambien right now, though. I mean, and have been off. I think it's been like over a month. And
Yeah.
I've had bad nights. I can't imagine, but it's like, it's 1, 2 in the morning, and I'm sitting here, like trying not to be on my phone. And
Yeah, no. And that's where then too, that you'll now know that, okay, if we can, really focus on getting you back to a normal circadian rhythm, like, and balancing out and supporting the progesterone and estrogen, you're going to feel like a whole different person.
well, it's all related. I mean, my biggest thing I think is always like on days where I had like 2 nights where I didn't have any sleep at all, I was miserable all day. Like, I literally was on my just sitting there like awake trying to sleep, couldn't sleep during the day, but I was useless.
Yeah, no, that's why I love this test, is just because when we really, put it all together, that we really then get that information on what we need to do to just balance somebody out. And everybody's different. So that's why I love this test for perimenopause, menopause, situations like infertility, PCOS, long hauler COVID. There's been a lot of things we found on women who can't sort of get past the long hauler COVID. I even honestly have a 17-year-old who has lost her periods that we're working with. And the Dutch test has given us so much information on what kind of approach do we need to take in order to help rebalance hormones. And
You didn't
what
lose a bunch of weight or anything? Like that's
what?
interesting. That's an interesting case. It wasn't like she lost, because I know when you like get too thin, you can't have your period. It wasn't
Oh,
like,
she just had a really bad case of COVID in her body. And we're seeing that a lot. Like COVID, the COVID spike protein actually does have an affinity towards the reproductive tissues. So the reproductive tissues, the lungs, they tend to be a little bit more like there's an affinity towards those tissues a little bit more. The red blood cells, the kidneys, and they say maybe the brain, but I've seen a lot of women after long haul COVID, and being introduced to the spike protein, that their hormones change, their periods change. And so the Dutch test has been really good for us there to really be able to see what's going on so that we can start to get the body back in balance. And then also I get a ton of this is actually one of my favorite things that's happened in the last, I'd say, like 3 years. I get I get women coming into my office at a really young age, like 18 to 25, who say, I want to get my hormones checked because I really follow people on TikTok who've said I don't have to go on birth control, and that there might be, side effects of being on birth control for 10, 15 years. And so they want to do what they can, to just get some information about their hormones and how to balance it. And I think that's fantastic, just because even if you decide to go on birth control, there's, even if you're like want to go on birth control, I still think if you're going on it for any irregular periods, heavy bleeding, or anything like that, first get your hormones tested and let's try to balance those out. And then you can decide if you want birth control for birth control reasons.
yeah, that was the interesting thing. So I got my period late for like, I mean, it was like 16, right? And
Mhm.
then I don't even remember when I went on birth control, maybe like 18 or whatever. And then, married. And then when I was trying to have kids, I remember I, went off birth control and just thought, oh, I'd probably, everybody thinks they get pregnant right away, right?
Yeah.
And I remember it was like, I don't know, it was like 6 or 8 months. And I started doing the what are they called? The ovulation things.
Yep.
And mine wasn't going off. And I was like, that's weird, right? So I went, a gynecologist, I told him, he's like, oh, that's interesting. And then sure as shit, I end up having two sets of twins. He found out I hyperovulate. I don't
Yeah.
remember what tests he did. So I know a lot of ultrasounds and things. So I wasn't ovulating off each side every month. But
Yep.
when I did, it was two, I mean, hence the two sets of twins, right?
Yep.
But it was like figuring out when I was going to ovulate, which was the funky part. And he said I had hyperovulation. But
Yeah.
then when I was pregnant, I was low progesterone and he was worried. So I remember I had to do the suppositories for that when I was pregnant.
Yeah. No, that's where too. I mean, it's just hormones are our superpower. Like women, I think that, when you look at it, like our balance of hormones and estrogen and progesterone is such our superpower. And I could actually talk about this like all day too, about how I just feel like we as a gender are more connected. And, even if you look at even other cultures and ancient routines, it was all about like getting women together, especially during times of their period. And women would sync up and they would put women in the period for like times of creativity and intuition to help,
There you go.
yeah, no, I mean, I just think that hormones are our superpower. And I think that the more we know about our own hormones, and, whether it is that you're dealing with something like Lyme and mold, or whether you just want to know what your hormones are, that's why I just feel like the Dutch test is really the go-to. There are some other tests that I use along the way, but like every woman would benefit from doing a Dutch test.
To get women to know that this is an option, especially for me.
Mhm.
Um, After like my first two, I had awful postpartum. I didn't know what it was. At the time, people didn't really talk about it. And it wasn't like I was crying. And a lot of it was my breast milk never came in. I never made milk, right? And I thought I was going to have, like, I didn't have contractions. I ended up having a C-section, but I was never really in labor because I was so big. I didn't have contractions. They put all those like things in to try and get me dilated. So never dilated. Ended up, like, I don't know, 14 hours, whatever. It wasn't like it was uncomfortable. Have a C-section, milk, my hormones were whack. I
Mhm.
wasn't sleeping. And it was the darkest time of my
Yeah.
life
It's
until
scary and just all around scary.
with the sleep thing. And I had night nurses, and I had more that privilege of, like, not family, but privilege of having the means to have people helping me. And I was off. And
Mm.
it's really, there's the stigma about it, of it. And I'm convinced my hormones were
Yeah.
completely. And what did they do? They threw Ambien at me. They threw a bunch of other shit at me and antidepressants.
Mhm.
I took through my second pregnancy. But what really, like what another part of like wanting to do this and wanting to share is, and I'm gonna cry telling the story because I don't know if you saw the girl. She's a nurse, and she's I think she's in Rhode Island or Maine, and she killed her three children and jumped out a window and is paralyzed. Did you see that story?
I don't not that one specifically. I don't think so.
Which it was on TikTok because I also don't watch the news for this
Yeah.
reason. And she she killed her through. I mean, she's just beautiful, married, had just had a baby, a newborn, and they showed the drugs that she was put on, and that was a freaking cocktail they gave me. In my heart, if you just see her, it's like she was, they put her in psychosis.
Mhm.
Not a murdering, this is a nurse. I'm with this cute little husband, this cute little family, and she killed her three kids, and she is paralyzed from trying to kill herself out a window. Like, at what point of we, of patients are we saying, like, no more? That's the Western medicine. Like,
Mhm.
they killed her and they killed her kids. And
Well, and that's where I just think that, like, the what I say to a lot of people, because I feel like it's true, is the reason that I have, gone away from doing a lot more traditional medicine is just the model of, when you look at it, that we don't really empower patients. We're more about, like, come to us and I'll give you the answers. And if I don't have the answers, then I'll just tell you to go on an antidepressant or try to get something out of my toolbox. But we don't, in the traditional medicine world, we don't have great tools to help people with, like, dysfunction. Like, we have, spent now 40, 45, maybe 50 years of the only real tool that OBGYNs have is birth control. And there's a reason for birth control. And like I said, I'm not, slamming it. But at the end of the day, not everybody needs to go on birth control. A lot of people just need to know what's going on with their hormones. And even if they decide, like I said, to go on birth control, then at least know what the underlying causes are to fix it. Because that's the thing, is that, then too, when you come to somebody, like, postpartum depression is a great example, because it's such a scary time for women. And it's, such a time where there's so much going on, and, so much going on physically, chemically, and emotionally, because you have this beautiful new baby. You think you should be the happiest you ever should be, and it's like, and you're so disconnected because of all of this, influx of hormones and dysregulation. And then when you go, unfortunately, to a doctor, and they sort of, don't offer you any answers on why this is going on, and just say, okay, we can try these drugs. And then when they don't work, I mean, you add a whole nother level of hopelessness to it. And so that's just where I think, there is such power in really doing a lot of these functional medicine tests, so that you can get answers. Because the other thing that I see that I don't think is talked about enough is, if you don't get the answers, like, if you don't get, why did this happen, or what is causing it, then you feel like you can never get better, because you don't even know, like, was this bad luck? Was this, something that's just permanent? And that is very hard for the human brain. When our human brain isn't able to feel like we're in control, then it really does add a whole nother level of problems and
you're
concerns.
just
So
fighting stuff, it's like, and everyone, like, everything, like my neck, like the things cause, like, it's in your, oh, just get up, just do it, just doesn't exactly work like that. you
Right.
know? Did
Exactly.
I think my main like pull of wanting, like of knowing I'm getting better, I'm not doing this, is first of all living with a sick mom and waiting for my mom to die. My
Yeah.
entire life has watched this woman be poisoned and be a sheep and get sicker and sicker. My entire childhood was a horrible mom because I mean that's a whole other bag of worms, but
Right.
like
Yeah.
she was sick all the time.
Hmm.
I think she was sick because I think I grew up in a moldy house.
Yeah.
So I'm getting my ton. I mean, my mom has spent since I was, and that's why I'm kind of null to it now, is getting prescription after prescription, cirrhosis. She's never drank, like one of all her organs, like in her quality of life, what I see, I don't want to be like her 79 years old.
Hmm.
So
Well,
at
that's
50,
why these tests are great then, because they answer the question, how can you change, sort of your projectile of what's going on right now with your health and wellness? Because genetics, we used to think genetics were the big picture, but genetics are about 5 to 20% of the story, depending on like what your genetics are. But our lifestyle and our choices are what make the majority of our health. And so we have a lot more power than we've sort of um, thought in the past.
So what is like the one thing like when women come in, and I'm sure like everybody's got different symptoms, but like the main things that you tell like a new patient to like absolutely get out of like your body, like you need to like stop, like
Everybody's a little bit different. I mean, I think there's a lot of stuff. That's why I am so passionate about, the different personal care and cleaning products. A lot of those, I mean, the way that that all started, and the reason, I really started looking into those is because of the fact that a lot of those personal care products and cleaning products have what's called xenoestrogens, which are foreign estrogens. And so it's those foreign estrogens that, are interfering with a woman's hormones throughout her lifetime. And so the more that we can take, out the parabens, the phthalates, even things like triclosans and whatnot that are hard on the detoxification and hormone pathways, the healthier we can be. So, I think that that all makes a big difference. Gluten is
huge
another one
difference.
that I think people have to limit. And for hormones, I mean, I do think it's a good idea to make sure all your dairy and meat come from as clean a source as possible, because they're exposed to a lot of hormones like dairy, obviously in order to produce more milk, they're given more hormones and whatnot. Now, I will say that I've had, because I am in the Midwest and very close to Wisconsin, the good old dairy cheese state, that I have had some people fight me that they don't believe that the hormones that, and I will say that I haven't fully gotten an answer, but that hormones don't end up in milk. And so maybe that's the case, except the only thing I'll say is that, whatever we're exposed to when we're breastfeeding, we talk about it getting into the milk. So I think, the milk is only going to be as good as how the cow's health. So,
I
that's where I think it's important, if you are going to do dairy, that you do clean sources of dairy. Goat dairy, goat cheese is much more like our own proteins. It's goat milk and cheese is similar to human. And so I think that's also a better option just because it's not such a foreign dairy, but dairy and gluten in the US is pretty dirty, unfortunately. I wish it wasn't true. I like both of them a lot. Uh,
I worked in
like
the
I said,
food. So
yeah,
I've been to the dairy houses. I've been to the slaughterhouses. I've seen fish like before. I remember Dr. Murphy would always talk about tilapia. I've seen how tilapia
that
are.
tilapia is real dirty, real dirty.
Tilapia was, honest to God, one of the most insane, disgusting things I've ever seen in my life. Of,
Mhm.
do you know what they're fed tilapia to eat?
No. Or
I'm a great addition to the cocktail party. Yes, they're fed like chicken bones. They
mm,
feed chicken bones, ass, shit. They eat chicken. They're like farmed above ground. It's the
mhm.
most disgusting. And the farm, it was the most grossest place. I can remember I came back from that trip. It was supposed to be like learning about it and like
Yeah.
actually selling it for Lent. It was like, I'm not doing like farm
Never
salmon.
touching tilapia again. Yeah.
Oh, I was on the ban on tilapia. I was in
Mm.
big trouble. They're like, no, you're supposed to. I'm like, hell no, I'm not selling that shit. No,
Well,
it's
and that's
filthy.
an important thing too, is I mean, it's not doom or gloom, it's not fear. It's like just we have to make better decisions because these decisions aren't being made for our health and well-being in general. Like if anybody, you know, saw how tilapia was farmed, you know, they wouldn't be like, oh, well, we're doing this to make humans healthier. Like, you know,
I think for
um,
me, this
if
round,
everybody knew like what, you know, they've done and allowed, like, so for instance, I mean, I share this fact all the time, but like the European Union has restricted 1,200 chemicals,
mhm.
between 1,200 to 1,300 chemicals in their products. We've restricted 11. Like we just allow a lot more crap into our like food and personal care products. So that's why I like teaching about this stuff, is it's not doom or gloom and it's not fear. I don't live my life in fear. Like I'll eat gluten, but I don't eat it all the time. I don't eat it every day. You know, and I can tell you, which, you know, a lot of people will say is I lived in Europe and I could eat, you know, gluten in Italy all day long, every day and not feel it. Where if I start to eat too much gluten in the US, like I definitely notice it because, yeah. So it's not doom and gloom. All it is just the more that we're educated, the healthier we can be.